Thank you, Professor Sulfikar, Professor Leo, and all distinguished professors and all participants. It is indeed an honor privilege to be back to NTU and share some of our experience from the neighboring city of Jakarta. Visit Jakarta is not that far from Singapore. And what I will be sharing today about urban leadership has a lot to do with the crisis that we went through since 2020, which is the COVID pandemic. And it hits countries across the globe, cities, and I think now is time for many of us to start picking up lesson learned. In bahasa Indonesia, there is a word called hikmah. Hikmah is lessons that you pick up after a period or after something is happening. Then it is called hikmah. And the hikmah is always coming after the crisis, after the event. No hikmah is coming before the event, before the crisis. So now it's time for us to start learning, picking up some of those lessons and prepared us better for future challenges. We hope we don't have to face similar challenge. But if we do, what are key lessons learned that we can pick up from the crisis that we had? So allow me to share some of the basics about Jakarta. Okay, yeah. Just a minute. Let me make sure. All right. Give you basic data. Jakarta is a city of 11 million people within the city, plus its surrounding, its neighboring cities, another 23 millions. So plus minus, it's about 35 million people in that area. And the city contributed about 17% of Indonesian economy. So on the one hand, we are congested in terms of populations. The number is 11 millions compared to the entire Indonesia, which is 270 millions. So the proportion is small, but on the other hand, our contribution to the economy is huge. And Jakarta is the gateway of Indonesia. If you enter Indonesia, then the gateway is Jakarta, and if you're departing to the world, it's always through Jakarta. So when we started to see a contagious virus in Wuhan, at that time it was December 2019. We were monitoring in Jakarta, and at that time it was still called pneumonia Wuhan. It wasn't called COVID, and I think SARS-CoV-2 virus was there, but rarely mentioned. It was basically pneumonia Wuhan, and we are monitoring closely. Why the Jakarta government monitoring closely? Because our city is having direct connection with Wuhan. There's many direct flights coming in, and then our city is the hub of Indonesia. If we are having problems, then the rest of Indonesia will, at some point, also experiencing what we are experiencing. So it was our concern. And I remember in the beginning of January 2020, we had meetings with inter-departments representative. And those meetings, the immigration was invited, the intelligence office was invited, all agencies that relates to mobility, that relates to international travels were all invited. It is a rare occasion because Jakarta government rarely inviting all those agencies that deal with international travelers. Usually it is, we're dealing with domestic travelers, but this time it was international travelers. The question was this: how many people coming back from international places where the virus have been detected then? And our data was so minimum. We had minimum database on tracking people. And I think at that time, we're not tracking people yet. We're not identifying where have you been visiting of cities, of countries at that time. So very minimum information. So immediately, we start our second approach. Let's identify to anyone who have symptoms similar to pneumonia Wuhan. So we send like a booklet, like a instruction book to all hospitals in Jakarta. If you are seeing patients with these symptoms, do report to us. What basically we're doing is this: let's anticipate what is coming from outside, and then two, let's anticipate what is happening within our jurisdiction. We have about 190 hospitals across Jakarta. So all hospitals were having these instructions and they have to monitor. So we have been receiving reports of individuals with similar symptoms of COVID. At that time, we're talking about early 2020, the authority to undertake the testing was not in the provincial government. It is at the national government, Ministry of Health. We have PCR machine to do testing for viruses, but we didn't have the reagent for extracting and doing the testing. Only labs that is authorized for certain virus, they will get the reagent for that particular virus. So SARS-CoV-2 was not on our list. So we didn't have the reagent, even though we have the PCR machine. So what happened was we keep sending samples collected from hospitals to our Department of Health, sending it to central government, to the Ministry of Health, the laboratory. However, we keep getting answer that the answer is no answer, basically, at that time. We didn't get, is it a positive? Is it a negative? Basically, we didn't get answer. We keep sending samples and we don't get answers back. Now, our team is reporting to the governor. The governor, we have been reporting this many. We have not heard anything back. What should we do? So we communicated with the Ministry of Health, demanding result, being informed to us. We didn't get any reply. This is talking about how should we deal when we are facing this kind of situations. What should we do? Should we just wait or should we do something? I decided to go to the public and report to the public that Jakarta, it was 1st of March 2020. I went out to the public and said, we have had X patients under surveillance, under monitoring. And these are numbers of individuals detected with symptom of COVID. And it was a news that the country has been avoiding for weeks. Nobody wants to talk there is COVID in Indonesia at that time. And it was I announced it in the morning, late afternoon, the Minister of Health were saying the number reported by Governor of Jakarta was incorrect. Okay? So basically, they were saying there is no cases. And we come up with that. But what are the key aspect here? Why there is that difference? The Ministry of Health, who has not been out front in explaining what is happening, and our approach that has been, let's open up, let's inform public. Here's the difference, or here is our lesson learned. During the period of January, February, we have been reading what is happening outside the country. Our team were monitoring news outside Indonesia, reading policymakers outside Indonesia, talking about COVID. If your team don't speak English, then you know nothing about what is happening outside the country. If you don't read things outside, you have to really understand what is happening in the world. So in March, not long after that event, I gathered about 150 leaders of our city. These are head of departments, head of agency, head of bureau, head of hospital, directors, all, about 150 people. Gathering, just like this gathering, 150 people. And I started the gathering by asking simple questions. Raise your hand if you read news about Jakarta every day. So all these 150 people were raising their hand, all of them. Because they work for Jakarta. They better read news about Jakarta every day. Everyone is raising their hand. Second questions. How many of you read news about Indonesia every day, national news? Almost all. Not all, almost all. Third questions. How many of you were reading world news, global news, every day? Only 7. Okay? So I mentioned to all of you. So for all of you, from now on, listen to what I'm going to say and trust me. Okay? Because you have not been following news outside Indonesia. If you don't follow news outside Indonesia, then you don't know that there is, a disaster is coming, and we better be prepared. Rule number one, I mentioned that in that room, do not handshake from now on. And everyone's like, do not handshake? What do you mean? No handshakes? Yes, from today, no more handshake. Social distancing. And everyone's saying, really, social distancing? We used to be very intimate, right? We meet each other, we kiss, we hug, we handshake, and then suddenly stop all of that. So all these measures that not us invented those measures. We are learning from others that have faced these problems earlier than us. It was March. Wuhan experienced it since November, December, and then Korea experienced it in January, and then Iran is around that time, Italy is around that time. We are picking up lesson learned from them. And we share that to our team. And then number two, what was also a lesson learned is this. We realized early on that this kind of, quote, disaster is going to take place in a long period of time, which we don't know how long. It could be a year, it could be 2 years, it could be 3 years. We didn't know at that time. But it's not going to be over in the next few months. And then we look at data of the last pandemic, the flu pandemic in the early 20th century. And you look at the data, it takes so many years for that pandemic to end. So we're expecting, and we start looking at numbers of casualties in Jakarta, in Indonesia, during the flu pandemic. And the numbers of death was quite significant then, in the 100 years ago. With long-term disasters like this, what is needed from government to the general public, in our perspective, is one word: trust. We need the public to trust us. If they don't trust us, there is no way we can collaborate. There is no way that the public is going to listen to what government is advising the general public to do, because it requires everyone to get engaged. To break the circuit, it requires everyone in our populations to be actively involved. So the key here is trust. If we build trust, we will be able to go through the crisis, and we'll be able to sort of allow our policy to be implemented by everyone, not only by a certain group of individuals, but by everyone. And that has been our approach. Why we had that in mind? I had the opportunity. I was to engage with city mayors across the globe. I was active in the C40. C40 is an association of mayors of big cities. I serve as the vice chairman of C40 steering committee. The chairman was the mayor of LA at that time. The vice chairman is the mayor of the governor of Tokyo and governor of Jakarta. So we organized many meetings with all these mayors. Who are the speakers of all these meetings? Mayors in cities that experience the pandemic early stage. So Mayor Park of Seoul, and then mayors of Milan, and then mayors of some countries in Northern Europe, Tehran, and many other cities that have experienced earlier than us. All mayors across the globe were participating on those meetings, and they were listening testimony of our fellow mayors sharing their tough times in a very emotional way. When they were sharing, sir, our hospital is unable to take care of all these patients. They are, on the hallway. They're in the hallway. They have, pictures that we have started to see in the months later. But at that time, we've been listening to all these mayors. And then they've been saying, please do this necessary measure. Preparing a quarantine area, enlarging your capacity. So many of these lessons learned from other places were being noted down, and we started to adopt that. But one thing that we thought was clear, trust is key. And to gain trust, at least there are 3 components of trust. One, and it's like a function. It's like a model. Trust equal 1, competence, plus integrity, plus intimacy. Then you get trust. You want to be trusted, you have to have competence. You want to be trusted, you have to have integrity. You want to be trusted, you have to have intimacy with whoever is going to trust you. So those 3 variables. But number 1 is on the competence. Then you need to understand the problem. We invited scholars, scientists to actually come and tell us what needs to be done. I remember a meeting in March 14, 3 days after WHO declared pandemic. Pandemic was declared on March 11. So March 14, it was Saturday evening, Saturday afternoon, we had a meetings and we invited everyone meaning all important stakeholders, the Association of Epidemiologists, Association of Hospital Leaders, head of faculties of medicine, and WHO. And this is also a turning moment for me, a turning point at that time. Why? The WHO representative in Jakarta confirmed he was going to join. When the meeting started, he wasn't there. Okay? So we called him and said, we have invited you to join. And they said, yes, I'm joining it online. Okay? We're talking about March 2020, not March 2021. Having a meeting online was still very rare. Okay? And he said, our procedure at WHO is we are no longer allowed to attend face-to-face meetings. We are only allowed to do an online meeting, teleconference. And it was an eye-opening for me. Oh my God. And we all here in the room, face-to-face, no mask, no face covering, and we were in the stage of ignorance at that time. Okay? And then this is an eye-opening statement from the head of WHO representative in Jakarta saying that I'll contribute. And during that meeting, we decided to close all schools in Jakarta, starting on Monday, 16th of March, and then close all parks, close all public facilities. The move was not popular at all. Why? Because the general public is not seeing victims yet. Okay? And we know the numbers is growing from our hospitals reports, but we are not seeing the result coming back from our testing yet. So we had to adopt a policy that may not be in favor of the general public. And number 2, the national government also not in favor of that policy. And you have to adopt it in the capital city. And that was sort of the constraints or the dilemma that we face. But we keep telling ourselves, we better do the right thing, because this is what all the scientists on epidemiology has been advising. This is the way to go. So on the competent aspects, learn from the expert. We were no expert on epidemiology at that time. So lesson number 2 is integrity. Tell the truth. No sugarcoating. Do not hide any numbers. Just tell the truth. And the truth may not be fun. It can be painful, but you just have to tell the truth. Without telling the truth, then we will go nowhere. So with that, give you one example of telling the truth. Look, this is funeral services in Jakarta since January 2018 all the way to February 2020. So this is monthly funeral services. Jakarta is perhaps the only provincial government that manages cemetery, that manages funeral services. No other provinces is dealing with this, but only us. There's limited space of land. So we manage cemetery, we manage funeral services. The average funeral services is around 2,700. That's average for 2 years prior to that. And then in March, suddenly it increased to 4,400. In April, that's the same thing. Something must have gone very wrong, right? On the other hand, the health department was not able to know what have been the result of our testing. We have been testing, and the test never come back to us with positive result. And you report to the Ministry of Health, and the Ministry of Health is coming back with no answers. So that was the kind of dilemma. And when we presented this, there was a general reactions. Pak Gubernur, please do not exaggerate the problem. Okay? Do not exaggerate. And what we are saying is this is fact. I'm not exaggerating. This is fact that we have been providing service at the average of 2,400, 700. Why it suddenly become 4,400? In spike. And then we look at hospital bills. Hospital bills was so interesting. Why in our insurance system? Because bills for pneumonia doubled and tripled. But it was categorized as pneumonia. Something has gone very wrong. As leaders in that city, I have to decide, should I keep this data myself and my team? Should I go public? Should I tell the general public? I decided to do the latter. I go out to the public and said, this is a fact and we better be prepared. Something big is coming up to our city. We are not realizing it yet, but we have to start a restrictive measure immediately.
Halo teman-teman, luar biasa sekali bagaimana Pak Anies Baswedan berbicara di depan Profesor internasional. Sangat-sangat membanggakan, sangat-sangat luar biasa. Pak Anies Baswedan ini paket lengkap teman-teman ya. Bagaimana beliau menjadi seorang tokoh, akademisi. Bahkan kalau kita lihat Pak Anies ini memang sangat kompeten ya di dalam semua hal ya. Beliau itu orang cerdas, pintar ya, berwibawa dan selalu diundang ke luar negeri teman-teman. Bukan hanya di Indonesia, sepak terjang Pak Anies ini pun di kampus-kampus luar negeri. Memang beliau dikenal banyak orang, bahkan kenalannya pun banyak. Jadi, Pak Anies Baswedan ini sangat cocok menjadi pemimpin Indonesia di masa depan. Bagaimana menurut kalian?